Today I will be administering a tube feeding. Since I don't have my supplies present, I will be verbalizing the skill. I would start out by verifying the medical orders. I would know the formula type and the route, rate, and frequency of the feeding. I would gather my equipment. I would check the expiration date of the formula before starting. I would perform hand hygiene. I would identify the patient using two means, look at their wrist bracelet and ask them their name and date of birth. I would assemble my equipment if I had it, and I would perform an abdominal assessment on the patient. I would position the patient at 30 to 45 degrees, which he is at, and then I would don gloves. I would verify the tube placement by means that we have done in previous skills. I would also check pH, and I would aspirate the gastric contents of the pH, and then measure the amount. For intermittent feedings, I would aspirate gastric contents prior to the feeding, and for continuous feedings, I would do it every 8 hours or according to policy. I would then flush the tube with 30 milliliters of water, and for pediatric patients, you would use the lowest amount possible. I would then remove gloves, perform hand hygiene. I would don new gloves and then administer the feeding. For open feedings, I would label the bag and tubing. I would then hang the bag. I would clamp the tubing and then prepare the feeding. I would attach the feeding setup and then set the ordered rate. I would then unclamp the tube. I would flush with 30 milliliters. I would clamp the tubing again and then discontinue the feeding from the tube. I would then maintain the patient upright for at least 1 hour. For close feeding, I would check the expiration date. I would label the bag and tubing. I would spike the container with tubing, and then I would prime it and connect it to the feeding tube. I would connect the tube through the feeding pump, and then I would set the prescribed rate. I would stop the feeding, discontinue from the tube, and then I would flush with 30 mLs of water. Then I would document